Good afternoon, everyone, and apologies for a couple of minutes late start. We are having some technical issues, as is always want to happen, but we are up and running and ready to go. Thank you so much for joining us for this webinar this afternoon on informing community projects with community health assessments. My name is Rebecca Bally, and my role today will be simply to help moderate. So on the next slide, we have a picture of how you can interact with us and type in questions. So before I turn things over to our expert, I just want to review a couple of things. We will keep everyone on a global mute throughout the presentation. And we are also asking everyone to participate in a 5-minute activity where you'll need access to your internet browser. We have plenty of time set aside to take your questions at the very end, but we welcome you to submit questions via the question pane on your control panel at any time. We can interrupt the flow of the presentation and ask your question if it's relevant at that time. But please do make sure that when you send the question that you send it to all presenters or all organizers and presenters so we can all see them. A question that we always get is whether or not you will have a recording and the slides. Yes, we are recording this webinar, and the slides and the recording will be available on our website within the next week. And on the next slide, we just have a few words about the Patient-Centered Primary Care Institute. So the Institute is a public-private partnership that was launched in 2012 with the support of the Oregon Health Authority and the Northwest Health Foundation. It is currently managed by Oregon Healthcare Quality Corporation, or QCorp. Together with experts we partner with, our goal is to get primary care practices connected to a broad array of technical assistance as they work towards the patient-centered primary care home or medical home model of care. We work to serve all practices at all stages of transformation and to build capacity and create alignment to support ongoing transformation and quality improvement in Oregon. We encourage you to visit our website, www.pcpci.org, to access resources, including previous webinars. And you can also sign up for our email list on that website, which is how we'll announce additional web-based and in-person training opportunities, as well as future Institute programs. The next slide just has all of the attributes of the PCPCH model of care. But what we are here to cover today, and what I'm excited to quickly turn things over to our presenter, is to talk about community health assessments and your community projects. So on the next slide, you'll see our wonderful presenter, Dr. Jacqueline Shannon, who brings her institutional knowledge from the School of Public Health and the Knight Cancer Institute community, as well as her wealth of experience working with communities to her position as lead of Community Engaged Research Core within Octree. Dr. Shannon's training and early career in population science has also informed her efforts to utilize both epidemiologic and community-based methodologies in addressing the long-term goal of enhancing community engagement in research and the research process. To this mechanism for working collaboratively with community groups and hospital systems in regions throughout the state to bring the power of academic research to community-level decision-making. The result of this work has been the establishment of the Community Research Coalitions. These coalitions, through the close interaction with local health systems and policymakers, provide a liaison between communities and researchers and work closely with community leaders to identify areas of research need and with academic institutions to identify investigators able to assist in addressing these identified needs. And with that, I am so pleased to turn things over into the capable hands of our presenter, Dr. Jacqueline Shannon.
Hi, great. Well, thank you. That was quite a wonderful introduction. Thanks so much for having me and giving me this opportunity to present to all of you. It's kind of odd not getting to see anyone's faces, but hopefully you will be chatting with us throughout my presentation, coming up with some questions that you might have. I know a number of the folks that registered to participate in this have probably been involved, if not taking the lead on community health assessments yourselves. So some of this I'm hoping will ring true to you and sound like some experiences that you've had, and hopefully it will add and contribute to how you think about conducting a future assessments as well as using that information to inform projects that you might be developing. And I do have control of the slides, great. So understanding community health needs assessment, and this is really about finding and using needs assessments to inform a project. I do want to take a few minutes to acknowledge this is a portion of a presentation that's part of a larger training that has been developed in collaboration with my colleagues at OHSU as well as colleagues at Emory and the University of North Carolina. This training is around putting public health evidence into action, and it was developed under funding from the CDC and the National Cancer Institute to our Cancer Prevention and Control Research Network. So there's a lot of hands that have been involved in developing this portion of the presentation, so hopefully it will be beneficial to you. And if people are interested in the full Putting Public Health Evidence into Action training series, you're welcome to email me. We were actually supposed to have a full training tomorrow. It's been canceled due to weather concerns, and so this will be happening in January, and people may still register for that if you're interested. So, all of that aside, for this session, we have a few objectives, and these are the objectives that were advertised initially with the training or with this particular session. So mostly walking out of this, I'd like people to understand and be able to locate community health assessments for your particular region, and importantly, be able to describe how the data was collected and how the community health assessment may be able to be used. I'm going to be able to identify some of the strengths and limits of community health assessments, and also how you can utilize these to inform the development of your projects or working with your community group to inform their projects. And again, do please feel free to send your, I would say interrupt, but I guess send your text questions to us, because I will go quickly. So for definitions, a lot of people look about, what is a community health assessment? It's really a systematic data collection, and really what is key on a community assessment is that it's telling us about what is the difference between what currently is and what should be in a group and a situation of interest. So what is really our baseline assessment. This is giving us all the information of what is the current state of affairs in the community or the group that we're looking at. And we want to be able to compare that to kind of what should be. And what should be is often defined for us by things like the Healthy People 2020, or guidelines that are coming out from the Diabetes Association. Where do we want to be? Our Oregon Health Authority sets standards or metrics for us for what would be ideal in terms of the health and wellness of a particular community. So frequently we're looking at that as what should be, and our assessment is telling us both what is the current state of affairs, and then helps us think about how to get to where and what we should be. What's interesting here is that we're doing this community health assessment for a group or a situation of interest. But frequently when we're talking about community health assessments, we think about these in the terms of a county or a public health region, a hospital catchment area. But a community can be really any defined group of individuals, and it can be defined around a geographic area, it can be defined around an age range, or it could be defined around an area of interest. So you could actually do a community health assessment that's just targeting young adults or individuals under 18, or targeting older adults. So as we move through this, you'll think about part of your community health assessment is actually defining your population. The other piece of a community health assessment that's important to not forget is that the community health assessment also identifies what resources are available within the community to address the gaps that you identify between what is and what should be. So it's more than just an aggregation of data. This is telling us how close does that data reflect where we need to be, and what other resources are available within our community. So human resources and organizations that can help address where gaps are. So who does community health assessments? These are required within Oregon for public health departments to receive their accreditation, and our coordinated care organizations, local mental health authorities, and nonprofit hospitals all conduct community health needs assessments. One thing that has happened within Oregon in a number of places, and this actually happens around the country, is there was a quick realization that multiple groups within a single geographic community were conducting these health assessments independently and have now begun to kind of function to form together and create single community health assessments where they're able to leverage the work of each of these different organizations. And so you might have one large community health assessment for a region or a community, and the hospital can use that or add to it, as well as the public health department and the CCO. So what's the purpose of the community health assessment? I'm just going to be checking my panel to see if there's any questions that have come up, and I don't see any. So the purpose of the community health needs assessment, first, it helps us identify where are their health concerns. And so this is where, it's identifying. Do we have a high incidence of low birth weight infants? Is there a concern with tobacco use in children under 18 or in our adult population? Disease metrics. So it helps identify what are the health concerns of our region, and then it helps identify what factors may influence health, as well as I said earlier, some of the assets and resources that can then be used to address some of those health concerns, as well as some of these other factors that may influence health. And that can be things like presence of insurance, it can be access to care. There's a number of other factors that can come into play and the health concerns that may not be the actual indicator of health themselves. But the other purpose of a community health needs assessment is really important, in that it sometimes falls to the wayside, is it becomes a really important tool for bringing together your stakeholders. So this is an opportunity for people to recognize in their community who is it that can benefit from understanding their community's health, and who can use this information to help guide policy, to help perhaps guide hiring changes, to help think about what are the metrics that we want to put in place to know how we're moving forward in the health of our community. So identifying who these stakeholders are and bringing them all to the table together really creates an opportunity to sort of move the healthcare of that region or that community forward. So ultimately, the community health needs assessment collects data that's needed to help prioritize goals, objectives, and then decide where to intervene. So ultimately, the community health needs assessment should provide the basis that we can then develop the projects and the interventions and the policies to move towards the goal of changing the identified health concerns that came forward through the assessment. Come on, computer. Right there. So for whatever, there we go. The computer was slow to respond there. So one thing we want to think about is in defining what the information is that we want to gather in terms of our community assessment, is thinking about all the different factors and the layers of factors that impact a person's behavior and health conditions. So frequently we think about individual level behaviors or knowledge or skills, and it's easy to see how an individual's behaviors impact their health and well-being. But there's also factors that come from interpersonal interactions, social networks, interactions with family and friends, through organizations, at an environmental level, community level norms and values, and then public policy, and how policy also then impacts both our behaviors and health outcomes. And so it's important to think about all of these different layers when you're thinking about what is the type of data that you want to be collecting. Ideally, we'll be moving beyond just individual level data to understand about interpersonal level data, organizational, community, and public policy level data. And all of these can inform the assessment. And then we can begin to think about how do you intervene at all of these levels to make a change when something has been identified as an area of concern. So I want to stop there real quick and see if there's any questions that have come up before we start walking through the kind of 5 steps in conducting the needs assessment, because I'm just zipping right through right now. Have we seen anything, Rebecca or Jennifer, that's come up?
Nothing so far, but I would just encourage folks to submit your questions as they come in. Even if you think we may get to it, we can tell you whether or not we're getting to it.
Okay, and feel free to interrupt me, Rebecca, if you see something come forward. So walking into the steps of how to conduct a community needs assessment, and I'm hoping there's some of you out there that have actually done this, so hopefully this will sound familiar to you. The community needs assessment starts initially with establishing a health assessment team, so pulling together a group of people that are going to be involved in conducting this assessment, collecting the primary and secondary data, and then it doesn't stop there. And sometimes that's where people do think it stops. You collect the primary, secondary data, you put it into a report, you publish the report, and you're done. But it goes much beyond that, and these are some important pieces, because beyond the actual collection of the data and creating the report, you need to analyze this data, aggregate it, and then interpret the data. And once the interpretation of the data is done, it's actually in reporting that back so that you can then determine health priorities as a team and develop goals and objectives for addressing those health priorities. So really all those 5 steps are part of the community needs assessment. It's not just the data collection portion, it's all the pieces, starting from the beginning of the team through actually developing goals and objectives to address some of the health priorities that are identified. So establishing your team, this is not rocket science, but you want to be thinking about who needs to be part of this team. And so I talked earlier about how a number of different organizations, particularly in Oregon, but across other states as well, are required to do community health needs assessments. And then other groups do them because out of interest, they're nonprofit organizations, and they want to be able to conduct a community health needs assessment also. So some obvious members of that team may be the people that represent the organizations that are both required to do the community health needs assessment, as well as other organizations that may inform their policy or where they plan to put funding dollars that may be informed by a community health needs assessment. So then there's also the people that may be really utilizing the results of the community health needs assessment that may be important to include on that team. And these may be some of the business leaders within a community. So you want to organize the team, identify tasks for the individuals on the team. So hopefully all the members of the team are contributing to the conduct of this needs assessment in one form or another. Some will have very obvious contributions. If you have a CCO who's portion of this part of the team, they are obviously going to be contributing a large portion of data, as will a lot of the healthcare systems. Other members may have their tasks on the team not as obvious. Maybe someone on the team is a principal or a member of the school board, and they're very interested in the community health needs assessment and as to how it impacts the students within that school system. But their role may not be as obvious. They can bring data from their school system, but they can also perhaps be involved in the conduct of some interviews or focus groups that would also help inform the data collection. So after identifying who's on the team, it's important to think about what are the tasks of each team member, and maybe some of the tasks for the team members will be simply you will be aggregating the data, or you will be reading and reviewing the final report. But each team member plays a role. Making a timeline, this is always ends up being one of those things that very few people are actually paid to do it. Even those organizations where it's a required activity, frequently there's not an extra pay or extra time to make sure that this happens. And so having a timeline established becomes really important to ensure that you can continue towards getting the actual assessment done in a timely fashion. And then finally, think about that question of, do you need a budget to do this? So if this activity is not written in to the particular budget of an organization, you may need to set aside or find some money to actually pay for the work that's going to be done as part of this community health needs assessment. So looking at foundations, other types of resources that may be able to help support conducting the assessment is important to think about up front. And if there is no budget associated with this, then you need to get agreement from all of those team members that they're willing and able to complete their tasks short of having a budget. So the second step after identifying this team is thinking about collecting data. So this is the easy and obvious part. But before we move into the actual collection of data, you'll need to think about what questions are that you want to ask. What things do you want to understand? So there's a ton of data out there, and you could throw your net very, very broadly, but you may want to start by initially defining where do you feel like there are some leading health concerns, what do you think may be the causes, where are there resources that can be used to improve health, and those may be some of your questions. So what are the leading health concerns? If that's one of your major questions, you'll need to think about then, okay, how do I collect data to identify a leading health concern? And we'll talk about primary and secondary data collection, but you can look at the clear first step in thinking about a leading health concern is what are people being hospitalized? What are you seeing a lot of within your community? And then stepping back from that and thinking about what health behaviors may be impacting that health concern. And then are there resources? So using a really simple example, leading health concern may be that you recognize from years and years of state-level data that lung cancer is a particular problem within your community. So then you could begin to collect data from the CCO, the hospital, the clinic level on the actual number of lung cancer cases, and even some information about their timing of diagnosis. Stepping back then, recognizing that smoking is a very key predictor of lung cancer, it will be important to identify what data is available currently or what data might you need to collect to fully understand smoking as a potential behavior that impacts that particular health concern. You may also want to understand some other factors that influence that. If you live in a region where perhaps there is other types of exposure, whether it be industrial exposures or radon exposures, that may be something very particular to your region that you would want to characterize in your assessment because you're recognizing that it is a potential, potentially related to a health concern. And then as you would want to, of course, go one step back further or up along that ecologic framework to look at a community level, what resources do we have that are currently utilized or currently available that would address this particular health concern. So you could step out then to, do we have access to quit line? Do we have access to early screening? And how frequently are these resources utilized? So then thinking about what kind of data will answer these questions. So you'll want to think about, are these data that have already been collected, and then be able to show evidence for support of your idea, and then be able to, can this data be tracked over time to show progress? So data collection methods, people are frequently very familiar with this idea of primary data and secondary data. Primary data is the data that you collect. So nobody else has collected it. You're not pulling it from another source. You're going to collect that data yourself. Secondary data is the data that's already been collected. It's already been aggregated and annotated, and it's published. It's either on a website or it's publicly available, or it can be pulled from a journal. And frequently, even though we'll present this first primary and then secondary, frequently on a needs assessment, we'll start with the secondary data first, because there's a lot of data that's been collected, and particularly if your assessment is looking at perhaps a county level, there's a great deal of secondary data that's already available and has been collected through either local organizations or regional organizations, state or federal organizations that you can use to inform your assessment. Then oftentimes what we'll do is we'll look and see where is the gap. So we may have a large amount of secondary data, but we may still find that there's some gaps in the information that's provided because we're looking at a local level or a particular subset of a county level that may not have adequate data. And so you'll need to combine with that some primary data collection that you do yourself. So some thoughts around primary data collection. There's generally two different types of primary data collection that we talk about, qualitative data and quantitative data. Both of these can contribute very significantly to the community health assessment. Qualitative data, this is the type of information that you get that is not numbered. So these can be unstructured or semi-structured interviews. This is where you're having the opportunity to learn either through observation or through talking with individuals in a fashion that can be replicated. You're talking with them and learning about what their understanding is, what perhaps beliefs are, what they're seeing within their community. And so these can be unstructured or semi-structured interviews. Unstructured would be, I have a few questions and I'm going to kind of let this interview go free flow and we're going to record it or take notes. Semi-structured, I might have a set of questions, but I'm not forcing you into choosing A, B, C, or D for an answer. I'm going to have you answer these specific questions, but I'm going to ask everyone the same set of questions. We can use focus groups. These are used quite a bit to really get an idea of a group of individuals' thoughts or beliefs around particular questions. So it's bringing together small groups of people. Generally, we look at about 10 people in a focus group. We'll have some guides to help a moderator walk through the focus group. But really, what's important is to raise a question or an issue to that group and then allow there to be discussion within the group so that all the opinions come forward. So an example of something like this could be trying to understand, because there's no current data documented around, what kind of access do your teens have within a community to opportunities for smoking cessation. So are there particular opportunities that they have, or what are the beliefs around smoking initiation in a teen population in your area? And then being able to open this up to the group and learn about the information that these community members may bring forward about their region. Sometimes you can hear things like, really what's going on socially with our community is that it is part of our social structure. So given where individuals work, everyone starts to smoke at a certain age. It's the expectation. It's the only way you get breaks in the industry. And so this is something that's almost a piece of the fabric of the community, and that makes it so much more difficult to implement cessation programs. So information like that coming out of these more qualitative interviews or small group discussions. You can also set up for public meetings or forums, really which is a much larger presentation, but still opening for discussion. And then you can do things like direct observation of the community or of the people, just watching and seeing what's going on within the community, almost more of an anthropologic type of capturing of data where you're making annotations and comments on the observations that you're seeing. Quantitative data is, these are the numbers. So here you could have a structured interview, could be quantitated, where you would rank people's responses in a certain way. And then what we often see used and seems to feel most comfortable to many researchers is the surveys, where you ask a particular question, you give response options on maybe a Likert scale that ranges from never to always, or 1 to 5, and you capture data this way. And some real benefits to this data is it's easy to pull the data together and to kind of make summary statements about what the information is that you have. But this quantitative data can be really useful if you're looking at something that's quantifiable. So perhaps the interest is in exercise, and you're wanting to know how frequently people are heavy exercisers, or how frequently people get out for a walk, or how often do they use the new bike path and bike to work? These are great questions for quantitative or survey data collection. Now, if you wanted to ask something more like, do you feel safe on the new bike path when there's no lights at night, you may want to have a focus group or have some interviews that can give you a little more information about what is it that makes you feel most safe using the bike path, and then you can begin to dive into that in a little more detail. So I'll just hesitate there for a few minutes and see if anything's come up. Nope. Okay. So other primary data collection methods, some important considerations. You want to think about who are the participants, who are you getting information from, are you getting representation of the group that you want to learn about. So if your community of interest is teens, and really the assessment that you're doing is looking at health concerns in the teen population in your area, you probably don't want to have the participants of your assessment be only adults, unless you just want the adult perception of the teen. So making sure, obviously, that these participants are representative of the group that you want to learn about. Thinking about the methods that you use to collect data. So there's all kinds of ways to get at both qualitative and quantitative data. And how you end up doing this can really influence who's likely to respond. So I think it's pretty clear sometimes we like to use an online survey. SurveyMonkey is a really popular approach right now. But if your work is primarily to understand the health concerns or the health issues of your older or retired population, perhaps online may not be the best approach to capturing this information. Whereas if you're interested in that teen population, trying to do a telephone interview over a landline may not be an effective way to capture that information. Whereas doing a text survey may be a very great way to get the students to get younger adults to respond to you rapidly. So there's lots of different ways to go about collecting this data, both quantitative and qualitative, and thinking that through and ensuring that it's the most appropriate approach for the population that you're interested in. So who is your community? And then understanding that's going to influence which types of people will respond to your surveys and respond to provide information. And if this assessment is intended to inform what types of interventions get put forward in the future, you want to be careful to feel that you have a solid understanding of the full population, not just a select few. And then, of course, how you collect your deep data can cost money, or it can take human resources. So thinking carefully about what are the resources that are needed to collect this information. So I might feel like the best way to get my information from my older adults is to go door to door and to sit down and to have a conversation with every older adult in my population. However, my working team may only have 2 individuals who have the time to conduct these interviews or the ability to conduct these interviews, and I might be looking at interviewing up to 500 individuals. That may simply be too resource intensive. It may not cost me that much more, but it may be manpower-wise far too intensive to think about using that as a method for data collection. So all kind of questions to ask yourself as you think through what is the community that we're collecting the data on, what kinds of information do we want to collect, at what level do we want to collect that information, how do we want to collect the information, do we want to do a combination of quantitative and qualitative in our primary data collection, and then burrowing down a little deeper, how exactly are we going to collect that information. So other types of primary data collection methods, and this is one that if you looked at some of the Oregon guidance on community health assessments, I don't think it actually gets talked about very much, but you can also do what are considered community audits, And this is really where it's much more around observation and counting, and looking within the community at different things in the environment that you may want to include in your assessment. So now we're getting up in the higher levels of that kind of circle of the ecologic framework, where we're looking at the social and the environmental and the organizational aspects that impact some of our health concerns. So we may want to do things like counting the availability of restaurants near a school site, or perhaps counting how many fast food vendors there are within a particular area, or counting how many unsafe areas there are in walking on a sidewalk, or really even just how many sidewalks are there if you're wanting to look at physical activity and whether people are participating in physical activity, understanding whether there are sidewalks, understanding whether there's cracks in those sidewalks, whether there's lighting in those sidewalks. These are all things that you can get that information by asking people, or you can go out there and you can have people just count up. I walked from point A to point B, and I counted that there are 5 areas where there are significant cracks in the sidewalk and there are no lights between these points that would result in a very dark and dangerous pathway that may impact or be a barrier to people participating in physical activity. So doing these kinds of community audits kind of helps you look around the community and actually begin to kind of count up some things that are more environmental that will have a direct impact on what people do, but may not be reported in any kind of secondary data collection that would be available to you through other resources, and is also very locally specific. So let's see, do we have any questions at this point? I'm seeing my little thing coming up.
We had a question about maintaining confidentiality of your research participants, especially if you're doing interviews and surveys.
Yeah, so if you're doing interviews and you're recording these interviews, sometimes it's hard to maintain face-to-face confidentiality. You're going to know who it is that you're sitting there talking to, but you can always record your information and keep it complete, keep it anonymous on the information sheets that you're recording the information on. So ideally, much of this will be, if not everything, will be anonymous. In community health needs assessment, there's very little reason to ever report anything at an identifiable level. And so in ways you can try to keep things anonymous is through never recording any of the identifiers. So you're not going to write at the top of your form, I did this interview with Mr. Jones at certain address at certain time, but you leave that information blank. You, as the person who talked to them, will know who you talked to, that that information goes to someone else who's going to aggregate the information from Mr. Jones with a number of other individuals, and that allows it to become anonymous when it gets aggregated together. I'm hoping that that begins to answer some of that question.
Yeah, I think that does. We had a follow-up about IRB approval and whether or not doing community research requires IRB approval.
So community research could entail all kinds of different things, and definitely if it's research, it may require IRB approval. I would end up saying that, for the community health needs assessment, generally this is not something that's going to require an IRB approval. You're conducting a needs assessment, you're collecting information, and it's being used to set policy. Ideally, this will be anonymous. If you're not certain, because the data may be used in another way that would be considered something that could be generalized and used to inform how people implement programs generally, then I would suggest that you can ask Human Subject Protection Program if they believe that this is something that needs to have IRB approval. Now, if you're using this information, or you're going to go the next step that we're going to be talking about in terms of implementing a project or conducting an intervention where you want to say, did my intervention work? and you're going to collect data and assess that intervention and potentially have identifiers on individuals, then you would be looking at a scenario where you would definitely need some degree of IRB approval, depending on how much you identify an individual. So I would never say as a blanket statement that community research does not need IRB approval. It absolutely does if it crosses the boundary into becoming research. My fallback is generally, if I'm not sure, if I think that perhaps I'm going to have some identifiable data on my needs assessment, or I'm going to use this for to improve generalized knowledge, then I would likely go and ask someone in a regulatory position, do you feel like I should put this through IRB?
Okay, great, thank you. And I will pause on other questions because we are running a little behind the time. So I want to make sure we have a chance to talk about your secondary data. So.
Great. So I wanted to take a few seconds to talk about some secondary data sources. So this is frequently something that we use to, as a first step in starting the community health assessment. So all kinds of data are available from federal sources, local sources, state level sources, nonprofit organizations that have been already aggregated together and are easily searchable. And so we had a little bit of an activity that we were hoping you could take part in. Rebecca and Jennifer, do you feel like we have time to do this as an activity?
I think we could do a really short 4 minutes.
Okay, we got 4 minutes. What I have here are 6 websites. I'm hoping that each of you may be assigned to going out to one of these 3 websites. All of these 3 websites have information about the different health factors, and I want you to just look for something very specific. We're going to be looking at adult smoking rates in Clatsop County, Oregon. So I'm hoping that you will navigate to these websites and look if you can easily identify how you can get information on smoking rates in Clatsop County, Oregon. See if you can find teen smoking rates. And the questions I would want you to ask is, what's the source of the data that you're looking at, if you can even find it? How old is the data? Can you easily compare it to state level data or to the country as a whole? And what else might you want to know? So why don't you just take a few minutes, a minute or two, navigate to these websites, and then give some of your responses back online.
Perfect, yes, and we did chat everyone a link to one of the resources. We split everybody up into 3 groups, so each cohort has a different website. And do feel free to chat in the responses to these questions on the, in the question pane, and then we'll read them out loud. And we'll give folks just a couple more minutes till about 2:48 or 2:49, and then we'll come back together as a group. Okay, just a note to folks to start chatting in what you found. We put ourselves on mute just for a couple minutes so people could explore the website, but we'll be online now and ready and eager to read out your responses.
So I'm curious if people have been able to find adult smoking rates specifically in Clatsop County. I know at least on 2 of these sites that information should be reasonably rapid to find. One site you have to dig a little bit deeper. It might be kind of challenging to find the information. Can people just chat in what percents maybe they found?
And by chat in, we mean put it into your question pane. So where that question tab is on the right side of your screen.
So while you're looking at, pardon me?
Yeah, I was going to say, I think we've got some shy folks on the call today, so maybe we should just help them out a little bit.
Sure, we can do that. So I'm going to go ahead and go to one of these sites just real quickly and walk through some of the ways we can find this. So I'll just choose County Health Rankings. This is a resource that comes out of the Robert Wood Johnson Foundation and a number of others. Just like a lot of places, it aggregates data from many sources. This is really, really user-friendly. So I'm going to go click on Oregon because that's what I'm interested in. I need to move this over a little bit. I'm going to select a county, and what did I say? Clatsop. So we're going to select Clatsop County. I'm interested in adult smoking. So I'm going to click on adult smoking, and over here it's going to give me some summary information for where Clatsop County falls in smoking level. I can see it on a map, so it tells me Clatsop County is CA. Now I got to remember where Clatsop County is in here. CA, there we are up there. So I can see it on a map, and I can see that the smoking rate incidence in adults in Clatsop is 17%. And I can look at a description of this and how this was calculated. Really important here is to take some time, if you use these resources, to understand where this information comes from. So the county health rankings, they are not collecting this data themselves. They're pulling out of the behavioral risk factor and surveillance survey. And so it's important to understand how this information is collected. They talk about the data sources. And if you're using this for your community health assessment, you may want to go to the original or the primary data source, which is the behavioral risk factor surveillance system, and look at the primary data as in addition to using this more general source, like the Robert Wood Johnson source here, to give you ideas of where your county, in this case, stands out differently than the rest of the state of Oregon. So one thing that I want people to notice on here, and it'll come up in the next slide real quick, is this is information that comes from, I believe it was the 2014 BRFSS. And so frequently on these sites, the data can be quite old. I'm going to go back to the slides real quick. So each of these sites is kind of similar in this same way. The reason I have the public health indicators out of the state of Oregon is there's quite a bit more searching that you need to do to get down to this level of information if you use the state of Oregon website. There's lots of state data, but it's harder to get down into the county level data. Community Commons is real similar to the Robert Wood Johnson, but it has different ways of looking at the data, and each of them provides some different types of data. But again, with all of these, you want to be careful to think about how is this data collected. These are some other places you can find secondary data that you may not always think about. Department of Transportation, they maintain all kinds of data. If you're looking at distance from care, if you're looking at road quality, different types of service organizations collect their own more local data. our federal agencies also collect all kinds of data. And almost all of this is available on online or through searches or even asking them directly. So some cautions about using this secondary data. It's really tempting because you can find all kinds of things pretty rapidly. So why don't we just use all of this and not bother with the silly primary data collection? Often you'll find local data is not really available. So I showed you class of counties. Well, I could look at Coos County and I could get, or Curry County, but what if I wanted something very specific, like I'm interested in Myrtle Point because my assessment is for the Myrtle Point community. The closest you're going to get in the majority, if not all, of these publicly available secondary data sources is going to be at the county level. So getting more detailed data locally can be harder. Data can be several years old, like I was showing. 2014 is actually not bad. Sometimes it's dramatically older than that. And then how things are defined can really differ across websites. So I could say adult smoking rates on one website they might define that as over 21, and on another they might define it as over 18. And it will appear to you that you have different numbers. And so it's important to read that text really carefully about where did this information come from and be able to reference back to that. So moving beyond the data, we want to look at the assets and the community resources. So thinking about what are the capacities of the community members, what kinds of physical structures are in place right now that can help move some community interventions forward. So how many hospitals do you have? Are there libraries? Are there recreational opportunities or recreational centers? Are there parks and open spaces? This can all contribute into that health needs assessment in helping to identify what are the social and environmental factors that may impact the health of that community. And then also identifying and assessing the organizations, what kind of businesses are in the area, looking at things like economic impact. Have businesses been leaving the area? Is there high unemployment? Are the primary businesses manufacturing, or are the primary businesses service-oriented? That impacts how people are able to engage in health-related behaviors. You can look at things like civic, cultural, and faith-based organizations. These can tell you a lot about whether there's social support available for that more of an interpersonal level. So learning more about conducting a community assessment, there's all kinds of information out there. So if you wanted to go to the NACHO website, they have a great source of information on how to conduct the community health needs assessment that walks you through. CDC has a phenomenal set of local guides and tips and tools that can also be used for not just conducting the health assessment, but then also developing the health improvement plan, which is the other aspect of the assessment, that you want to move this forward to identifying health concerns and then ultimately goals and objectives around changes in healthcare or health behaviors. So number 3, analyzing and interpreting your data. So here, you're looking for changes, trends, or emerging issues. If it's the first time an assessment's ever been done, you're obviously not looking for changes immediately, but you're trying to get a baseline. Hopefully you'll set this up in a way that anybody could replicate the way you collected your data 2 years later and be able to assess for trends or look if something's changed or see if something comes up that didn't show up on your initial assessment. Try to avoid data overload. So you'll spend an immense amount of time collecting data, but not all of it needs to be reported, really trying to hone in on where are the areas of concern in the community that you're assessing. And then where are the areas of strength? So where's the community doing really well? Or there's been a change in a positive direction. You want to discuss what this data can mean to your community. This can be a written report. You can compare to what we were talking about earlier, the Healthy People 2020, the county health rankings. Where are you supposed to be? What is the target? And how do you move from the baseline to the target? And making those comparisons. Those are often really important when people begin to think about policy. So using this next to determine health priorities. So this is where earlier we talked about that your process doesn't stop just at the data collection and putting it into a report. Now you need to share this report. You need to identify these stakeholders, some of which are on your team and some of which are kind of broader than your team. Who needs to know this information so that they can begin to make changes or implement programs and use it to support the programs that they're having. So sharing this information, it can be done in a community forum, is a great way to do it. Looking for feedback from people about the information that you're sharing and whether you missed something that maybe needs to be in the next assessment. And then identifying or determining what are the priority areas. And this can be done through ranking. It can be done through voting. I think in this picture they have the little sticky vote type of approach. So trying to get an agreement among the stakeholder group as to what are the priorities based on the community health assessment that you'll need to be addressing within your region.
And we're going to be running just a couple minutes over, so just want to thank everyone for joining us if you have to log off, and we will continue recording this. So, all right, that's all.
Okay, my apologies. Community health needs assessment can be used to guide projects. You want to identify both goals and objectives. And I'm going to walk through an example here real quick of what this might look like. We're going to skip SMART objectives. People can hopefully take a look back at these slides and think about how SMART can be used to best write an objective. But to give an example of how we can use this community health assessment to actually develop goals and objectives and develop projects. So one of our goals could be cervical cancer screening. This is a national goal from the Healthy People 2020. The goal is to increase the proportion of women who receive cervical cancer screening. What is the baseline? So right now in the 2020, the baseline is 84.5% of women receive a Pap test within 3 years. That was based on 2008. You would want your baseline to be based on your own community health assessment. And then what should the target be? And here, your target can be set by Healthy People 2020. It can be set by the Oregon Health Authority. It can be set by your own agency. But what is your target? So our goal across all of these stays the same, but you'll see that what we're doing is identifying objectives that relate to each of the levels of the ecologic framework. So individual through policy. And this is an example of some.
Doing fine.
Risk factors for cervical cancer. How would you do that? An education program. You want to be able to change attitudes and look at increased screening. You could also have goals at an interpersonal level. So you want to be able to measure whether people are talking to their friends and family about obtaining cervical cancer screening. Is the word spreading? And this can be assessed through interviews and it can be assessed through surveys. And you can also look at this at an organizational level. So here you can actually say 3 new participants identified organizations provide cervical cancer screening. So are you helping people understand that there is new organizations or organizations identified that provide this screening? So what kinds of things can happen at the organizational level? And then finally, where do you find your community health needs assessment? These are some examples. If you get onto the slides, I don't know if these links will work when you go into the PDF, but generally the easiest way to find a community health needs assessment is online. The vast majority of them are published online, and they may be published as their health improvement plan, which is really how the area plans to address the concerns that were identified through the assessment, or they may actually be published as the community health needs assessment. So this were just a few take-home points. I wanted to make sure that everyone walked out of here recognizing that a community health needs assessment is truly a team effort, that the health assessment is really only useful if it's used for guiding change, implementation of interventions, helping us understand how do we get from the baseline that we're at to the target where we need to be. And then thinking about what are the local factors that influence health. And I think that's it. So that was a zip at the end, and hopefully there's still some folks on the line.
Perfect. Yes, thank you. And I want to apologize that we had technical issues on our end that had us start late, so that's why we're running just a few minutes over. But thank you, everyone, for joining and for staying on. Wanted to just say with the links on the PDFs, those should be active on the slides, the PDF of the slides, which we will post on our website along with the recording. And I think everyone's questions were answered, even with the zip at the end. So I encourage folks to email us if there are any questions. We have a short survey or post evaluation survey where you can submit any lingering questions, and we can make sure that Dr. Shannon gets those.
Great, thanks. And I do believe I had my email address on there if anybody wanted to reach out directly. And if anyone else is interested in any of the other training opportunities through the public for our putting public health evidence into action training, I'd be happy to share information about that.
Perfect, and we can post that as well. So thank you so much, Dr. Shannon, for lending us your expertise and for being patient with us for our technology issues. And thank you so much for who called in and joined us. And here, wishing everybody a safe and warm next couple of days.
Yes, stay dry.
All right, have a good afternoon. Bye.
Bye.